my name's Conjunct Professor Adrian Dunlop, and I'm the Director of Drug and Alcohol Clinical Services for Hunter New England Health. 17 years working as Director of Drug and Alcohol for Hunter New England, and this year will be my 30th year in drug and alcohol. So I worked in Victoria before. I was in New South Wales for about 14 years or 13 years in the NGO system at Turning Point Alcohol and Drug Centre, and then I've been up in Hunter New England since then. I do clinics, rural clinics at the moment at Armidale, Inverell and Moree, Narrabri. So that's where I do most of my clinical work. I also do some clinical work with the Substance Use in Pregnancy Service that's based here in Newcastle. But I do cover for other clinics from time to time too. It's always an advantage to have some prior drug and alcohol clinical experience, but we do take people who don't have prior experience. And I guess the biggest single thing that is usually pretty clear early in the piece is how people go in working with people with drug and alcohol problems. And usually when people have got drug and alcohol problems, it's not just drug and alcohol problems, they're also mental health challenges. People often are, come from lots of social disadvantage, and there's multiple other things. So I guess it's capacity to work with somebody who has all of those sorts of challenges. Our different teams have to and need to provide good clinical supervision, because there's lots of challenges in working with people who have lots of challenges they've got to sort of face and work with. So that's really important that we do that, and we do that well, and support people strongly in those areas. But yeah, that's probably the most important thing, and it's not for everybody. And sometimes people try it and it doesn't work for them, and that's okay. But there's generally some good skills people can learn in working with people with drug and alcohol problems. We have medical rotations, so we have first or second year postgraduate doctors who do 10-week rotations with us in the withdrawal unit at Belmont Hospital. That's great exposure for them. Most of them don't end up becoming drug and alcohol specialists, but in terms of the rest of their career, it's really good exposure to in-depth drug and alcohol work in a very supported environment, so they understand some of the basic practicalities of helping people try to withdraw from substances. We have different other registrar positions. So at the Calvin Mater, there's a registrar position that goes between gastro and drug and alcohol, and that's a good mix of different drug and alcohol and gastro type problems, and there's lots of overlap there. Again, those people don't all go on to become addiction specialists, but we have had doctors come through who then decided to do addiction training. Psychiatry is another one where we have people doing usually 6-month rotations, sometimes they're 12-month rotations. And we have had addiction psychiatrists come through. We're one of the few places outside of Sydney, New South Wales, that have addiction psychiatry training and addiction medicine training. So that's really important for us to have people going through our local program here. And of course, they know the local service as well, and get a chance at having time not just in Newcastle but also across the district. We have our own internal training that we provide, sort of based on our particular needs. But there's lots of stuff available online these days. The professional societies, so APSAD, they do a webinar series. DANA, they do different online education. NCRED, the National Clinical Centre for Research in Emerging Drugs, they also provide online services. NDAC provide lots of the different universities do. So there's quite a wide range of things available, and yes, we do support our staff to go to conferences too. So, try to make sure they can not only learn things but also network with other clinicians across the country. It's always good to make contact with people locally and ask them questions about what the role's actually like, and we're very happy to take calls or emails. If people want to get a sense of what things are like locally, I think that's a good way to do it. Yeah.